I'm Dr. Anupa Sharma. I'm board certified in endocrinology, diabetes management, and metabolic disorders. I'm a physician with Penn Medicine, Princeton Medicine physicians. Today, I'm going to talk about your thyroid, common thyroid conditions, and treatment options. According to the American Thyroid Association, an estimated 20 million Americans, slightly more women than men, have some form of thyroid disease, and nearly 60% of them are unaware they have this condition. But whether you know you have a thyroid problem or not, diagnosing and treating the condition can have a considerable impact on your quality of life. The thyroid is a butterfly-shaped gland located in the lower front of your neck, below the voice box, which is the area where the Adam's apple protrudes on some men. It is the engine of your body, producing hormones that have an impact on all aspects of your metabolism and providing the energy you need to function. However, when the thyroid is not working properly, the gland either cannot produce an essential hormone or it produces too much. It affects the body's vital functions like temperature and heart rate. The most common cause of hypothyroidism is Hashimoto's disease, which occurs when the thyroid function becomes impaired and the gland is unable to produce the necessary amount of hormone. Left untreated, the gland can stop working altogether and cause problems such as obesity, joint pain, infertility, and heart disease. The opposite problem, hyperthyroidism, occurs when the gland produces too much hormone. This condition can be caused by an autoimmune disorder known as Graves' disease, a viral infection that causes a release of thyroid hormone, or increased activity from thyroid nodules, which are small growths within the thyroid gland. If hyperthyroidism goes untreated, it can lead to weak, brittle bones, as well as heart rhythm disorders, changes in the structure and function of heart muscles, and heart failure. The main factors to consider as you assess your risk for thyroid conditions are age and gender. Your chances of being hypothyroid increase with age, and they're greater if you're a woman. Hypothyroidism most commonly occurs in women older than 50. You may also be at increased risk for hypothyroidism if you have a family history of thyroid disease, you have type 1 diabetes, rheumatoid arthritis, or another autoimmune disorder, you have taken antithyroid medications or have been treated with radioactive iodine, you have had thyroid surgery, or you have been exposed to radiation to your neck or upper chest area. Although hyperthyroidism occurs in both men and women, it is up to 10 times more likely in women and occurs more often in people who are over the age of 60. You're at higher risk for hyperthyroidism if you have a family history of thyroid disease, have pernicious anemia, have type 1 diabetes, have primary adrenal insufficiency, also known as Addison's disease, consume an iodine-rich diet or medications containing iodine, or were pregnant within the past 6 months. It's important to watch for the signs of hypo and hyperthyroidism. If you're experiencing any of these symptoms, please discuss them with your doctor. Signs of hypothyroidism include fatigue, weight gain or difficulty losing weight, coarse, dry hair or hair loss, frequent muscle aches, cold intolerance, constipation, or dry skin. Signs of hyperthyroidism include rapid heart rate, weight loss, heat intolerance, difficulty sleeping, frequent loose stools, or sweating. Because most people are not aware that the symptoms they're experiencing are the result of a thyroid condition, problems are often initially detected by a primary care physician during an annual exam. In many cases, simple lab tests can determine if the thyroid is functioning properly, although in some instances, further testing may be needed. Successful treatment for hypo and hyperthyroidism often is limited to medication. If you're diagnosed with hypothyroidism, daily thyroid hormone replacement usually is very effective at restoring thyroid function. If you're diagnosed with hyperthyroidism, an oral medication to block the production of thyroid hormone can be prescribed. Because thyroid disease can have an impact on your quality of life and can usually be successfully treated, It is advisable to contact your doctor if you are having symptoms. Once diagnosed and treated, your body's natural balance and overall health can be restored.